Your doctor has asked you to have a look at this presentation on a condition called Anserine Bursitis. I'll start off to try and explain the condition to you before we talk about recommended exercise treatments. So let's have a look at the anatomy of the Anserine bursa area. You see that there are three tendons tying into the side of the knee on the inside of your knee, just below the joint line. These three tendons are tied into the thigh and above, and so they're involved in the movement of the hip and the knee. Underneath those tendons, there is a small bursa, and pain can arise from any of the tendons or from the bursa underneath. Give you this condition term Anserine Bursitis. So you can see from those diagrams of the anatomy that there are a number of different structures that can cause problems on the inside of the knee just below the joint line. At different ages, different things can be operating. So in younger people, you often get a problem due to local trauma or to athletic overuse. In middle life, it may be to a more chronic problem, so something is happening over a longer period. So doing a run in which you're unaccustomed to doing the run, or a walk in which you're unaccustomed to walking that distance, in shoes that are inappropriate, that sort of thing. In older people, you can also get problems just due to wear in the tendons. There are other factors that can contribute to the problem, things like obesity or valgus in the knees, so that you get altered mechanics in the knees. And mechanics can be altered by things like flat foot or pes planus. They can be altered by the overgrowth of bone related to an arthritis. And sometimes the arthritis is considered to be causing the pain, when in fact it is something that is a lot more remediable and a lot easier to deal with than the arthritis. Typically the pain is on the inside of the knee, just below the joint line. It's of diffuse nature. It's worse when you get up from sitting down or go up or down the stairs. Usually reasonably comfortable walking quietly on a flat surface, but it can cause problems at night when one knee lies on the other, and that can cause pain. Because there are a number of different structures involved, it's best to stretch and strengthen the different structures in all cases, because that will help get rid of the problem in most cases and prevent recurrence. I would suggest you do some simple exercises on the side that's sore, but later, as things get better, do the exercise on both sides so that you're strengthening the same structures on both sides and you prevent the possibility of recurrence of the injury. The exercises involve stretching and strengthening. First of all, the stretching of the inner thigh muscles. So an exercise such as this. Put the 2 feet together, sole to sole, but let the knees fall out and press down to stretch the muscles on the inside of the thigh. Hold down for about 30 seconds and then relax for 4 or 5 seconds and repeat this 4 to 5 times daily. Each time the knees will fall further down as the stretch takes effect. And then we need to stretch and strengthen the quadriceps, the big muscle in front of the thigh, with first of all the stretch with this type of exercise. Bring the heel up to the bottom and reach back with your hand to pull and stretch the quadriceps. You can do this for about 10 seconds and then alternate to the other side while the left side is resting. And once that's been done, alternate across to the other side. Repeat this about 5 or 10 times twice daily. If there are difficulties pulling the shin, one can use a towel or belt or tie to bend the knee and stretch the quadriceps. Eventually the stretch will be good enough that you can help it with your hand. Alternate way of stretching the quadriceps is to stand, keep the thigh straight, bend the knee and assist the full flexion with your hand from behind. It is important that the thighs are kept parallel so that there is a stretch on the quadriceps on the front of the thigh. One stretches for about 10 seconds, relaxes for 4 or 5 and repeat the stretch. One can alternate from one side to the other. It is important to keep the thigh straight and avoid flexing the hip. and then strengthening the quadriceps exercise. You can do it in a number of different ways, as you see from this video, and you pick one that suits you and is comfortable for you, and do it. Put a rolled towel under the knee, press the back of the knee into the rolled towel. This elevates the lower leg. Point the toes towards the head. Hold for 5 seconds and let the leg rest down slowly. Rest for 3 seconds and repeat this. This will activate and strengthen the quadriceps. The next method involves lying flat. Will strengthen the right quadriceps. So bend the left knee with the foot at the level of the right knee. Lift the leg so that both thighs are parallel and the foot is pointing towards the head. Lift for about 10 seconds and then let the leg down slowly, under control. Rest for about 5 seconds and repeat this cycle about 10 times twice daily. And then I want to stretch the hamstring muscles using this particular technique. So sit forward, back straight, knees straight and fully locked out. Stretch forward and hold for about 10 seconds and then relax for about 3 or 4 seconds and stretch forward again, this time a little further, and you can feel the stretch underneath the hamstrings as you do this. Hold that for a count of 10 and then relax back for a count of 4 and then forward again, and each time one goes a little further forward, and repeat that about 4 or 5 times twice daily. And then strengthen the hamstring muscles. Use a chair for balance if it's needed. Bend the knee to 90 degrees. Keep the thighs parallel so that the hamstrings alone are being worked. The weight of the lower leg is itself the weight for strengthening the hamstrings. Hold for 10 seconds, relax for 4 seconds, and repeat. You can also do it alternate legs and repeat this about 10 times twice daily. Will give the hamstrings a good workout. Later, with better strength, one can use weights on the lower limbs to make the hamstrings work harder. Now, there are other ways, and there are more elaborate ways of doing these stretches and strengthening, but these are simple enough strategies to follow. And in many cases with Anserine bursitis, they will begin to resolve the problem over a week or two. Problems should continue to resolve as you continue to do the exercises, and I would suggest doing the exercises once or twice daily initially, and then once daily, and continue them long after your symptoms have settled down. Look after proper shoes, look after your weight, and see if you can get it down if it needs to be brought down. And exercise, calm, quiet exercise is possible, and you should be able to walk comfortably once this has resolved. This simple approach to Anserine bursitis will help most patients. There are some cases, however, where this is inadequate, and if your symptoms are not resolving or they're getting worse, then I think you should revisit your doctor, have another check with regard to the diagnosis, and he or she may send you on for more specialized treatment that is beyond the scope of this simple medium.